Yes, I hope all participants are here. So participants, this is to bring to you all information that you have to continuously and regularly fill your attendance, and also feedback form is sent to you for every speaker, that also you have to fill. So right now we are starting our session from Dr. Mridu Sahu ma'am, NIT Raipur.
Okay, thank you, Priyanka.
Just I want to introduce ma'am, Dr. Mridu Sahu is currently working as an assistant professor in Department of Information Technology, NIT Raipur. Ma'am has done her graduation in Computer Science and Engineering in 2004 from Maulana Azad National Institute of Technology, Bhopal. She completed her post-graduation Master of Technology in Computer Science and Engineering from RIT Raipur in 2011 and completed PhD in Computer Science and Engineering in 2018 from National Institute of Technology, Raipur. She is having more than 10 years of experience in teaching. Presently, she is working as an assistant professor in the Department of Information Technology, NIT Raipur. Ma'am has published more than 25 research articles with a very good background of research in various conferences, journals, and book chapters. Ma'am is currently also editor of book Brain and Behavior Computing. And ma'am research area includes data mining, brain-computer interface, sensor devices, and visual mining techniques. So, ma'am, can we start with our session?
Yes, I'm sharing my slides. Just
Yes.
wait.
So, over to you, ma'am.
Yeah, thank you. Yes, good afternoon, you all. The slide is visible right now.
Yes, ma'am.
Yeah, thank you. Yes, I'm Dr. Mridu Sahu. I'm the course coordinator of your event also. And due to the some urgency of the Dr. Garg sir and sir, our speakers, I'm taking this lecture. And tomorrow, IIT Indore, Ramvilas Pachori sir will take lecture at 10 o'clock. So here, my topic is the role of intelligent computing in disease and disorder detections and application of biosignals. As we know, the signal, it means it is a data, it's a continuous data. We have to take care of this. And the different type of devices supports we are using in current era for disease and disorder detections. So what is the role of that intelligent computing? Because we are saying the intelligent computing is required in everywhere uh, for the disease disorder. But these things are not practically easy. So my presentation is for based on this, what are the challenges you will face and the different type of devices, how you interact for the disease and disorders detections. These all are my presentation outline. I will discuss the two case studies with you. Here, the biosignals, the word is full form of the data, such as the atmospheric data, images, text, numeric data, biomedical signal data, genetic data, sensor data. Because normally we are saying that the data is a generalized word. So if you are saying that the data is a generalized word, but what are the subsets of it? What are the nature of it? So depends upon the nature of the data, your methodologies, your extraction method, your pipeline. As the BK sir introduced, the pipeline of that computational intelligence, these all are the phases of the mining or extracting the useful patterns from the information. But which type of informations you want to exactly process? So this particular process depends fully upon your data. So the data may itself as an image type, just like your MRI images, your the different type of X-ray images. So one or two lectures you already did on that area, how to process that image. So the image processing tools and techniques involved for that purpose, how to process the image data. So sometime in a medical science, the text data we also want to process. So the NLP type of involvement over here, it is called a natural language processing. Suppose the doctor wants to say something in a text format, and what is the interpretations of the doctor, how the patients want to understand, how the medical person understand, how the lower staff wants to understand, because the doctor, they don't have a too much time for explanations of each and everything. They don't want to write the things properly in that text format also. So the mining or the natural language processing tools and techniques involved over here for text processing. So the Xenia tagger and the different types of tagging systems is involved in a NLP. So once you want to work with the text data, then the text mining tools and techniques is also plays a very big role in that area. The next one is a numeric data. Definitely the computer system wants to handle easily the numeric data. If your data in the form of that numeric one, then it's quite easy for each and everyone for understanding or the interpretations type of thing. So this sometimes this images will convert into a numeric one, this text will convert into a numeric one. So different type of converters is required for converting your the useful information in a numeric or a discrete forms. Then the machine can understand easily for processing part of view. As a computer science engineers, in that area, my role is totally different from the some of the lectures already done, because we are working for the process side. So in this process side, we have a good repositories of the data, but the process on data is important because we have to give the instructions to the computer. So which type of instructions is useful for converting this text data to the for computer readable form, the images data into a computer readable form, biomedical signals data, because all the EEG device, EMG device, ECG device, all it will give the timestamp data to us. We have only the two columns with us, the time along with the amplitude values. So this information processing unit, how the process will involve for process of that varieties of data is an important task. So next, each data contains the important information to a particular event. That's why the maximum machine learning programming environment, we are knowing that it is always a NP hard problem. What it mean by the NP hard problem? It is a non-deterministic polynomial hard problem. So if you are saying that the X method, which is good enough in an image one, we can't say it is a good in a text for, it is good for your sensor one. So based on the nature of the data, you have to decide the complexity as per the variety of informations you have, variety of algorithms you have. So the selection of that process is important. It will decide which complexity will present for your processing units. So in the next point, the automations of the data interpretations using the computational technique. Computational, it means how the overhead the computer wants to bear once you want to process your data. So extract and analyze the important information from the data. Different techniques are subjective. Statistical techniques, somehow we want to recognize the nature of the data by the statistic, because the dispersion of the data, the group of data. So the nature of the data finding by the different method, and one method suggestions is a statistical techniques, and another is a data mining techniques. As I'm working in a data mining techniques, how the data mining will help in a healthcare or for analyzing your informations, and this information, how this information will convert into a knowledge, because the hierarchy of the data is saying that the data, the raw data has a huge size, and this data will convert into information, the information will convert into a knowledge, and based on this knowledge only the system will become intelligent. Just like in a virtual reality, we studied that how this virtualizations concept come out in a era of that healthcare, and the statistic is come out in your healthcare. But the particular task and the particular objective of all is that we want to extract the useful information, the very concise information, very summarized information from our huge data. Then the processing unit will take a lesser time, it will take a lesser amount of space, it will give a response in a quick manner. These all are our objectives. Okay, so the signal analysis through intelligent computing demonstrate their capabilities in medical research for understanding of body based on the scientific process. Yeah. So being a specific in a human body, biomedical signal having the complex structures, once you can see over here, because the many things involved for recognitions of, because if you want to take that the heartbeat, so you have to use a different device. If you want to take a muscular activities recordings, it is a different device. If you want to take for the hand, eye, so the parts of body, it is a very complex. So the complex type of machines or the complex type of sensor involvement in every area. So the specializations, once you see that the doctor positions, I'm also visiting the n number of doctors, I concerned with them for many type of diseases. They are saying that we are very specific, we don't want to go in the other side. If we are a doctor for that colon cancer, so we are not able to complete give the analysis on that one. So because the body part itself a complex one, so the involvement of that different type of devices in a different body parts have a different nature also, different signals generation also. The type of data may be different, because sometimes we play with the image, sometimes we play with the text, sometimes we play with the continuous sensor data. So the nature of data will give the issues and challenges in the computational task. We are taking the example of that brain. A brain is a complex. The working of brain is also very complex in nature, because it deals with the huge information simultaneously. As we know that one, the random signals and the normal signals. This brain analysis is quite difficult in a healthcare site, because it will generate not give any specific type of patterns for analyzing it. So this task quite difficult for us. So this create a challenge while recording the data from brain, because the one student coordinator, Mr. Hardik, is also working. He is going daily in AIMS Raipur for gathering the informations, taking the data from the brain signals. So this environment creations, the instrument environment, the patient conditions, all these things will affect your recordings. So if you have a fine recording, then your interpretations will go in a right direction. So data interpretations of the BAME signal becoming a major area research to establish in that one. The biomedical devices are used to assist the physicians and help them diagnose many medical problems. Here we have mentioned the sum of the sensors, because we are not able to say like that we are good enough researchers in a EEG, parallelly we are good in a ECG, parallelly we are good in a MEG, because the invasive property, non-invasive property, complexity of the channel positions. So if you want to start your journey in as a researchers or as a beginner, so you have to concentrate which particular sensor have a minimum number of channel, and you have a patterns like a synchronized pattern, or you can say it is the pattern you can analyze easily. So if you are a beginner, so you go in that direction for the ECG. Do not go directly to the EEG, because EEG, the pattern recognitions and analyzing of that signal is quite difficult as compared to electrocardiography. Electrocardiography will give a certain type of pattern, so analysis of that pattern is quite easy as compared to electroencephalograph. But for that the n number of research is going in under my that is in sleep analysis. So sleep analysis, the golden standard is, it is mentioned not here, is a PSG, is a polysomnography. But the polysomnography have the n number of sensors, for brain signaling also, for ECG also, for MEG also. Yes, any questions? Is there any questions? Some noise is coming. Please mute yourself. All of you, please mute yourself. So these devices are widely used in the disease and disorder detections for the healthcare. Brain can be analyzed with the EEG, ERP, MEG, fMRI, and CT scan. Because are introduced the breast cancer possibilities, what are the things involved for analyzing this. Here we are introducing the which type of devices are responsible for taking the signals if you want to work with the brain signals. So the brain signals, you can take the information from the brain analysis by using a electroencephalogram, event related potentials, MEG, fMRI, CT scan. So biomedical signals means the biosignals which are generated in a biological systems only. The biomedical signals are observation of physiological activities of body organs. So ENG, electroneuroscience, for the signals from nervous system. EMG, electromyogram for muscular activities is ECG, electrocardiograph. ERG, electroretinograms. So you can choose anyone, but you have to take care, as I told earlier. You select the minimum number of channel first. You select which type of biomedical signals gives patterns for better analysis. Then you will start your project as a beginner in that area. Okay. So EEG is a electroencephalography. We did our work in that area. In electroencephalography is a EEG. So the history of EEG was started in 18th century with the experimental related to that identifications of electrical property of the brain, and discovered by the German physician Hans Berger in 1929. And EEG acquisitions, frequency, amplitude, morphology, and these all are the keywords we will discuss further once we will take the case studies also. So once you have a particular, once you have visited any hospitals, that the one separate section for recording the brains, so you go and see that there also how they will record that signal, what are the basic things we have to remember before recording this. So the n number of different type of electrode placement is there. So the 1020 is an electrode placement international standard for fixing the particular channels on a head. If you are able to see this one, in that case, that the second figure it shows itself the central lobe. That's why it is saying that FZ, CZ, PZ. Then the frontal lobe, the temporal lobe. So here the keyword is mentioning in which particular, because the brain also having a different parts. Okay, so analyzing of that, if the one hospital in a Bangalore it is situated, so you can see that the particular section wise the expert or MD was setted. If it is a case of that the frontal lobe, then the frontal lobe analysis is different from your temporal lobe, your central lobe, your parental lobe, your occipital lobe. So based on this positioning of the system, the disease and disorder can recognize. So all channel are not completely involved for particular single disease. So some of the channel will involved in for X disease, but they will not involve for the Y disease. So the 1020 system here, the as per the DSP, the digital signal processing side, if we can consider like that, because we will get a different type of frequency bands. So this frequency bands is saying that the gamma is less than 25 hertz, the beta 12 to 25 hertz, alpha at 8 to 12 hertz, the theta 4 to 7 hertz, and delta is 1 to 4 hertz. So if you are working on the one frequency band also, so you can recognize that the beta is responsible for some of the disease, gamma is responsible for some of the disease, alpha. So this particular that frequency band will give a answer for disease and disorder detections. So elementary informations we are giving till 12:30. Then we will go in a depth of the site, how you can recognize a signal and how exactly you process that signals. Okay. So the EEG acquisition variable, the frequency, amplitude, morphology, and periodicity. So EEG acquisition components, which components we have to involve for this signaling is electrodes, electrode gel, electrode positioning, impedance artifacts, filtering. And EEG signal wave patterns, frequency bent are the alpha, beta, gamma, theta, delta. So once you start your journey with the EEG, so you can work on it, because firstly you have to work on the different type of frequency, which type of frequency is responsible for which type of disease and disorder, which type of placement, which type of lobes are required, or attention for your attentions for particular disease. So this system of electrode placement, the International 1020 systems, 1958, they proposed that one. And right, still we are using that one, because they partitioned that the positioning of brain in a different channel wise. And this, clearly you can see that one, FZ, CZ, PZ. And in my work, I worked on that Stephen Hawkins. So these central lobe was more responsible other than this one. But I can't say like that. It is the channel selection is also again a NP heart problem. Why I'm saying introducing that NP heart problem, if your particular problem you have selected for your project point of view, it is a polynomial soluble problem, then there is no need of that research in that area. Okay. But if your problem is a non-soluble problem, you can, then only you can find out the solution using a Turing machine, using the different type of analysis, by different type of sampling, by different type of this. But it will work only the sample of the particular problem. It is not this NP type of NP complete and NP hard, you cannot generalized. You are not able to find a generalized solutions. You will find out the solution for a specific event, a specific disease, a specific disorder. So be careful for selecting your problem, whether your problem is a soluble and non-soluble problem. If your problem is a non-soluble, then you have to find out whether your problem is a NP hard, NP complete, or it is a non-soluble mode. So you will choose the problem like that, the NP hard, and the some section of that problem you can give the particular solution for particular event or particular disease and disorders. So the higher density electrode settings such as a 1010, 10.5 systems allow the more than 300 electrode positions. So the brain and EEG signals are saying the electrocephalograph is a test used to find the problem related to electrical activity of the brain, and EEG tracks and records the brain waves pattern. A small metal disc with thin wires are placed on the and then send signal to a computer to record the results. Here clearly you can say that one, the temporal lobe for the memorizations. The frontal lobe is indicating which type of problem solving, creative thinking, personality. So once you will select the particular project where the creative thinking will involve or analysis, the grasping ability of the problem solving phenomena, then the more responsible lobe is your frontal lobe. Then the temporal role, if the memorization point of view, the temporal role will involve the brainstem, the basic life functioning. If you want to check whether the parts of the body and all these things will clear or not, then that brainstem or lobe is responsible. Then next one is a balance, coordinations, motor learning. Another lobe is responsible. So you have to choose like that visual functions you want to analyze, whether the particular patient having the good visualization or not, or these things, the reading ability, understanding of the language, so speech, visualization, these all for this parietal lobes. So you will decide as per your problem will lie in which section of the brain. The brain is a most complex part of our body. So an EEG track and records brain wave patterns. A small metal disc with a thin wire are placed on the scalp and then send signal to a computer to record the result. Normal electric activity in the brain make a recognition pattern through an EEG. Doctors can look for abnormal patterns and indicate it. So The another device is a PSG. As I told, it is a polysomnography, but it is a most complex one. It is placed in a, some of the good hospitals. One is placed in that Delhi. So polysomnography is called a golden standard for sleep stage analysis. So many people are nowadays they are using that wristwatch, and it will give the sleep pattern also. But this sleep pattern is a approximate analysis of the sleep patterns. But the polysomnography is showing that it is a golden standard for the sleep stage analysis. The tendency of the Indians are like that: if they have not taken a good sleep for the 4 to 5 days, they are not bothering about that. But once you go in a good, they are bothering about their health. Once they have not taken a single day good sleep, they go and contact to their doctors, why we have not taken a good sleep. Because once you take a sleep duration, sleep analysis with your body, you can think like that, because the refreshing point of your body organs is totally depends upon your sleep patterns, sleep analysis, sleep durations. So this particular device is very good for this analyzing of your sleep patterns. So this is a multi-parametric test in a performed during the night at the dedicated sleep room in the diagnostic centers. Recorded a various parameters like a brain waves, eye movement, oxygen level in a blood, heart rate, heart rhythms, air dispersion of the nose and mouth, body movements, etc. So my father is admitted and he is suffering from the cancer. So most of the time I have not involved with you. And the doctor yesterday, I just talked to doctor. Every day he's coming and telling to my father, have you taken a good sleep? How many hours you have slept? So my father is just saying, no, I have not taken a 3 hours, 4 hours. Then their analysis, their dose, their chemotherapy will fully depends on the refreshing point of your body. So this will give a major role, the patterns of the sleep in for the medical areas. So include that EEG, EMG, EOG, ECG, positive airways pressures, and the respiratory systems all will support this PSG device. So the PSG device, it is not a single one; it is a composite one. So for the good sleep, if the person having the tendency like that कि वो बिल्कुल उठ के बैठ जाता है, the some person having that they are walking at the time of sleep. Some person have that sleep patterns, they are just snoring type of things. So many type of disturbance and many type of analysis we have to come up, and we have to consider as for analysis of the sleep patterns, sleep goodness. So how to evaluate that sleep goodness patterns? All movement, all the body parts will involved. So in that case, the helpful for diagnostics, the system for the sleep and the neurological disorders. Once I have started my journey as a PhD scholar in 2014, I have selected that device. Yeah, but in that time I don't know the complexity of device, because it is a composite device. So I'm a learner. I just confused that one, because it's a how I will analyze the EEG also, EOG also, EMG also, event marker also. Then I think over that, okay, I go for the small section of that one, who is the most responsible for that sleep pattern. So sometime I have find out that some of the very good research in that area for the analyzing the, you can find out the sleep patterns by the brain itself. So I started and switched that one. The EEG will also give us some basic information about the sleep pattern, but the PSG we can't ignore. The PSG is a golden standard, and this golden standard will give a appropriate analysis on the sleep disease and disorders. So EEG in a sleep stages. Here the stage 0. The stage 0, because the sleep stages are saying that the stage 0 is a wake up stage and the eye close stage, and the open eyes, The responsive to external stimuli, intelligent conversations, close eye and the intelligent conversations. So which type of waves involved over here for the stage 0? So sleep is again divided into a many stages, just like your body parts is divided into a several complex sections you have. The brain is itself divided into the many complex sections, the frontal lobe, the temporal lobe, and that one. So if you want to analyze that sleep, then the sleep also is divided into a certain stages. So this slide we will discuss after the 15 minutes. The 12:45, I will take your lecture from 12:45 to what the time, Priyanka, for this
Ma'am,
that
it's
one?
2:15.
12:45
2:15.
to
15.
2:15. Okay. So okay. So we will complete this all these things in your after 15 minutes. Okay. We will again reassemble after 15 minutes. Thank you. Thank you all.
Thank you, ma'am. Participants, you can take 15 minutes break, and after that we will join you.
Samriddhi, just stop the recording. We will take a fresh recording for that one. Okay.